Welcome to my show, Lifestyle with Dr. Mobi. I am Dr. Mobi. Welcome you everywhere in the world. Today we have great episode and great guest. And before we go there, I'd like to kind of go over a few things. Our lifestyle has changed tremendously with pandemic going on. So I thought it would be great if we go over these lifestyle changes, especially affecting our diet, our understanding of whole pandemic and to deal with this situation. So a lot of changes are happening as we know, a lot of stress for everybody to go through this and then come up with a plan to go back to our life. So today we have great guest, one of leading psychiatrist consultant from UK, Dr. Saima Niaz. We welcome you, Dr. Saima, today. Okay, so tell us about your right now assignments and what do you do right now, and then we'll proceed.
Thanks for inviting me, Dr. Mobi. My name is Saima Niaz. I'm a consultant psychiatrist, and I have been working in the field of psychiatry for more than 20 years. And I have experience of working with World Health Organization and World Psychiatric Association in the past. And currently, I'm also working with Association of Pakistani Physicians and Surgeons in UK.
Okay, well, thank you. And how are things in UK compared to US? We'll talk a little bit, but how are things? Are you back to your homework, telework, or is it just doing some part time?
At the moment, here in UK, people are using different things, like they are going to work where it's needed, some inpatient ward, on psychiatric wards, and mostly we are trying to do telework where it's possible.
Mhm. So we got a lot of questions about telework, and I would like to first emphasize with all this pandemic, there's nobody knows really incidence of these mood disorders, anxiety, depression. One guess is 75% increase. So we don't know. I mean, they already are at very high numbers to begin with. So with all these anxiety, depression getting worse, like to first see what do you find is the worst right now? What is your normal experience with all the patients or colleagues asking you?
Currently, it's because COVID-19 is a novel disease at the moment, and its presentations and method to treat this disease are still evolving. So people are not sure at the moment how to live their lives because we have been asked to change our lifestyles drastically. And people are confused. Yes, I have been asked questions about what to do. There's so much time now available, and also some colleagues, they are working from home and it's difficult to work from home because kids are around. Also some are feeling not motivated to do work. Loads of emotions are going around at the moment.
So also for general education, I'd like to point out some of the features with anxiety and depression. They can coexist, and some are a little different. So with depression, you can have problem with sleep, and you can have a problem low self-esteem. You can have problems not getting motivated to do anything, sitting for hours maybe and not talking to someone. So those are a lot of, and some people actually overeating or not eating at all. And with the anxiety, they feel like their heart is racing and they just feel so anxious all the time. So, what's your experience so far? More people are more anxious than depressed, or
People are, there's a mixture of feelings around going on, loads of emotions, because situation is everywhere. It's unpredictable and uncertain, and no one knows when this will end. and we have been asked to confine ourselves to our homes. And the uncertainty regarding how to deal with the current situation with limited resources is leading to loads of feelings, as you mentioned. These can be a part of depression and anxiety, but people need to be aware that these can be normal also. And just normal part of our emotions. We need to talk about that, and it can be because this situation is not normal. A pandemic we haven't come across for centuries for with pandemic situation, and um, everyone I feel is going through a part of grief and adjustment at the moment, and the people can experience these things while adaptation to a significant life change, loss, or stressful life event like this pandemic. So I would say at the moment people are going through grief, like loss of freedom, loss of lifestyle, loss of their jobs, income, and also trying to adjust. I would not say it's adjustment disorder, but adjustment reaction, trying to adapt to the new life situation where we are still uncertain what's going to happen. And I would say that most significant losses, what I feel and what I have seen come across, is loss of freedom and loss of control on our lives. Sense of control is incredibly a part of human life, and people are still people are feeling just loss of their freedom and lack of control on their lives.
Earlier discussion, there was we were talking about a lot of people were used to be on the phones and they would not talk much with their family or among especially kids. But now with and they would I've never seen them outside so much, but now for all of a sudden they are forced to be on in front of computers and everything, and they're missing outside. So, and you're right, there is some element of control. So now they are forced to do things they're not happy with the lifestyle. So that is an important point, because human nature is like, if you restrict on something, then it becomes not really what they expect. Expectations, there are a lot of expectations they have or freedom they have, and that's gone, right? So, how do you think people should um, basically adapt to that? Is there more denial right now, or there is acceptance, or which phases you think they have? Right?
I would say people are going through, some are because everyone has different personalities. So people will take different time to adjust to the situation. So some are going through the adjustment phase, and some are still in denial. And uh, there are people who are protesting this reality. There are people, I have heard people saying that it's not contagious, it's not lethal, it's not going to affect them. They are not following social distancing. That's quite scary. So yes, there are people in denial. Acceptance, which is a powerful tool, and people need to think about and what's happening around them, because it's reality, it's crisis, and it's real, and it's happening around us. They need to accept the reality. This will lead people to discover what they can control and what they can't control, and how to lead their lives. Because if they'll accept the reality, then it will help them to also think about the future, and also to calm themselves.
Okay, so one of the questions we received was that normally people will have a difference between workplace and their home. So that line is blurred because now they are doing work from home. So they find it that their freedom is gone. So although one can say you're sitting at home all the time, and then what to complain about? So what do you think, how they should manage that?
Because regular routines are very important in our lives. routines also give us structure and framework and give us a sense of safety and comfort. So I was discussing this with one of my colleague. He's a doctor also. So he's currently working from home via telemedicine. And while talking to him, yes, I would suggest to people that wake up each morning at a regular time. Make sure also those people who have kids, they also wake up at the same time, get dressed, and also set it aside same time to do their homework without distractions, and make sure also children have breaks throughout the day. And also people, my friend, he has done an interesting thing in one of the room. He has pasted office on a sheet of paper. He wrote office and he has pasted on the door. So he is using that room as office, and he wakes up at the same time, dressed up, sits in the office, and he makes video calls. And his um, experience is that there is a better bonding in video calls compared to voice calls. And yes, I would also suggest to people that also to set times for their regular meals, and also sleep for sleep. You are sleep expert, so you know how much sleep is important.
Mhm. And so let's go a little bit tips. I think audience can see those. So try to make sure, try to do any of extra meditation, mindful apps, so breathing exercise. Those are really helpful. Some like prayers, so they continue with that, and those are waking up, keeping your sleep on time. Regulation is very important. Always tell that, look at, there is a reason there's a blue sky outside, and that's all animals actually, their rhythm, circadian rhythm, is basically controlled with the blue light. Okay, so you have to wake up on time, and all rhythms of body, whether they are endocrine, which are your hormones, or whether it's a sleep related, or whether it's physical, they're all related, or they have their normal rhythm, and we cannot disturb that. So if you disturb that, then you will feel depressed, you will feel sad. And so if you're not getting enough sleep, of course it's going to affect your mood disorder. Same stands for if you are not getting sunlight or strong light. There is a lot of seasonal disorders which people get that. So I said, yes, social isolate distancing does not mean that you don't go out. Just go out, keep your distance, but you need to have some time to give this positive energy to get your rhythm back, or at least keep it in a circadian rhythm. So don't mess up that, because you're absolutely right about keeping your circadian rhythm, sleep, and eating healthy. And so let's also cover some of the body response in anxiety and depression. So if you can educate us about, with anxiety, how body responds to any anxiety or stressful situation.
So I would say that we are aware of fight and flight phenomena. So when we are stressed in a stressful situation, our body releases adrenaline, cortisol, and we are prepared for fight or flight. So in this situation, yes, we are. It's stress, but it's unknown. There is unknown enemy there out there, and we don't know when this will end. So it's going to make people feel stressed all the time, affecting their mental health and physical health. In physical health, it can present as hyperventilation, increased heartbeat, chest pain,
Mhm.
tension headaches, a feeling of suffocation, excessive worry, as if something is going to happen. Even people can have panic attacks. And psychologically, there are worry, apprehension, crying spells. There are symptoms, feelings of there are even people can have thoughts of suicide um, while feeling anxious.
Mhm.
if it's
So,
going to be a huge, and if it's going to, people are going to stay in this heightened state of alert for longer period of time, then
mhm,
it will affect them, and these anxieties can turn into a disorder and depression, or they can have depressive disorder.
mhm. So the other thing is, there's more important we also like to discuss is that incidence of abuse, whether it whatever, there are different types of abuse, and we'll cover some of that. With pandemic is one thing, but there's a higher incidence of abuse reported by family members because a lot of people are at home. So can you tell us a little bit about that? And
Yes, I was reading about that, and there was an interesting research I found. It was by Professor Gab of the Open University, and she was saying that usually a couple spend an average, on average, 2.5 hours together each day, but nowadays people are spending 16, 17, or even more hours together. And I will say here, I will give you an example of um, and every person is like a pressure cooker, and with its caps on it, and as long as the cap is on, no one knows how much pressure is building inside it, and people need to relieve that pressure. So um, in the past, before this virus, we were having these relief points, exit
Mhm,
points, like going out for holidays, and also shopping, parties. But now these exit points, these have been removed. So people need to relieve that pressure. So unfortunately, it can turn up, can exhibit as verbal aggression, physical aggression, and whoever is close to them, it's going to, they will be the victim of that abuse. And also, there are so much worries going on at the moment. Many people have lost their jobs, no income, and lack of personal space in the house, and also lack of childcare, lack of also public resources to enjoy, like cinema houses are closed, and everyone is worried about health. And there are health anxieties about this virus, so it's building up this pressure. Um, and so people are going to take, some people, they can, there are going to be increased incidents of violence, or towards women or men, or towards children. And some people are going to use even drugs, alcohol, excessive alcohol, or going to abuse drugs, which can further can increase the rate of violence towards um, unfortunate ones. And I was also, I looked for it, and in UK, there is the National Domestic Abuse Helpline, and they are saying since lockdown in UK, 25% increase in calls to helpline, they have noted. And recently, CNN, they are saying that there is also significant increase in calls to helplines, to crisis lines in USA. And everyone, I would say, should be encouraged to ring these helplines, crisis lines, and to seek support. And also, they should be ringing these helplines on behalf of someone else also, to help
mhm.
them.
So that's a great point that, if you suspect any abuse, whether it's a verbal, physical, or any other abuse, then you should report and then try to actually find help. So there are good resources every county has, and find your local resources, call them, call your provider. Don't be afraid to call your provider, talk to them, and say, the behavior has changed. I see a big change in whatever. There will be some, but if there's a pattern, make sure you report that and seek help. There's a help. So it's a temporary phase. In the hopefully with all these things improve and keep on improving. So other thing is, where do you find some solutions for common people beside calling the doctor online? Some resources, do you suggest any?
Yes, one is, I would say, telemedicine, and so many psychiatrists are offering um, helplines or Skype. They have added their IDs, and which is free. I have seen it on WhatsApp. Some are free. So I would suggest people to look for that. Also, many counselors, they need to look out, as you mentioned, in their county or in their district for free counselors, and definitely make use of such resources.
Mhm, mhm. And also, how do you find? I know with all different kind of ethnicity as well as sexes, where do you find is the abuse worse? Is it in more whites, blacks, Asians, or different civilizations, populations? Or
I don't have any stats around this, and also, but what I have noted and also COVID-19, it's an evolving situation. What's going to happen in this situation? We are all at the moment monitoring it, but we have learned from Ebola that women, they are specifically vulnerable in this situation because they have not only their role is primarily to look after family and children. And in such conditions, when there is a pandemic, epidemic, they are the unfortunate ones who are in such situations. They have to look after their children, and with loss of job at home, spending more time. So, and they have less autonomy in some cultures. In some societies. So women and children, because children are unable to say if they are feeling something, if they are feeling angry, they sometimes cry, feel grumpy, feel restless, or anger. So children, especially children and women, and there is a very good article in Lancet published in March last month about effects about COVID on different genders. So it was also highlighting about women and lesson what we learned from Ebola outbreak, how women were kept even after such crisis was over. Women were kept at home. They were having less autonomy, and they were the unfortunate ones.
well, we are one thing for sure. It's a team effort. We providers, are at the front line, and we want to make sure everybody is safe. Well, other thing which is very interesting, and I'd like to also touch a few points, is the provider or front line doctors burnout. So, where do you feel, being a provider, providing care to COVID-19 families, to patients, and especially working in the hospital, there's a burnout of nurses, burnout of doctors, and unfortunately, a lot of providers died. So, how do you want to say something about some of those stress?
It is a stressful situation, and it's difficult for everyone, and especially difficult for healthcare providers because are at front line. And we are also hearing about PPE and now loss of many lives. It's not only about them. It's they are leaving their families at home, and we are aware how to. If one is exposed to COVID-19 patient, then how they should be avoiding or separating themselves from their families. So it's hard for their children. I have seen so many distressing stories of health nurses and carers who are living separately because they have to provide the care, and their children are living separately, but they are keeping in contact with their children via video chats, and also their other family members are looking after their children, and they are using in here in UK we have shorts rounds where people can go and express themselves. Our practice is different in different hospitals, so not everyone is going to have this chance to express themselves, their feelings. But it's highly recommended here that every ward or every facility should have a person who should be arranging such meeting so that staff can express their emotions and um, talk freely about how do they feel. Because talking about emotions, knowing about them, getting making yourself aware of your own self will help to deal with distress.
Okay. Well, thank you for bringing those great points. So finally, I'd like to emphasize on diet too. So there is a lot of stress provokes what we call stressful eating habits. People tend to overeat and especially crave for carbs because they tend to be uh, comfort foods. And there's also, I think, interesting thought that these are actually help your neurotransmitters and serotonin, and they make you feel good about stressful situation. Do you see a lot of patients tend to gain weight and kind of stay away from healthy?
I'm not sure about the patients at the moment, but yes, my colleagues or other friends, because nowadays people are working from home and there's lots of time, and food is freely accessible. So people are eating more, they are cooking more, and also there's lots of time for everyone. So it, these are early days, we don't know how to react, what to do, so people are struggling. So yes, I have seen people cooking more and eating more.
Okay, great. Yeah, so I had a few colleagues. You're absolutely right. They asked me, and I said, best thing is yes, if somebody is in habit of constantly eating junk food, just replace that with healthy food. So my advice is like put cucumbers or which are low calories. So don't eat junk food. You can still keep eating healthy food. And if you are in a habit of every 5-10 minutes or 15 or 30 minutes going and looking in and seeing if there's anything, just try to replace it with healthy habits. That's all you have to do. Just pay attention to this. You don't have to eat a lot at one time. Eat slowly, take your time, and enjoy the food. Don't just finish everything in 2 minutes and you don't know what you ate. So it is very important that that we pay attention to that, because ultimately our health is very important. The best defense we have against this is right now we don't have any treatment or vaccine. So best defense is our own health. So make sure you wash your hands and you keep social distancing. Pay attention to your diet. Do not develop diabetes, because that's one of the leading causes of immune compromised situation against this virus. And same stands for your if you have high blood pressure. So there was study about ACE inhibitors, and how they are at increased risk of um, getting this infection. So those are very important. Ultimately, it always comes down to your health, how you maintain it and how you practice it. So this, like any other disease, this will also pass, but it's very important that we take care of our. So any final thoughts you like to share?
I would like to add, because yes, very rightly you said, mentioned about these these habits. I would say, because there's people have loads of time at the moment, and they don't know how to fill it up. So I'm going to suggest to think about starting new activities with involving family members and kids. Like I have given in my slides, like reading, it builds vocabulary for children, writing creative stories or whatever comes to mind, it will help them to express themselves. Drawing, painting, art therapy is a good way to deal with negative feelings, and also like cooking and gardening. And some of my friends have started planting vegetables in their garden, so it's a healthy and exercise too. So I would suggest also adding some physical activities in their
Mhm,
daily routine, especially for children, because World Health Organization recommends activity, uh, at least 30 to 60 minutes activity,
mhm,
depending on individuals, their physical limitations or their health.
mhm. And that's a great thought to basically add maybe walking, if you have treadmill or something, doing that. and adding this to your daily routine. Gardening, perfect, more relaxation. And for walking, you don't really have to run. Actually, you can walk in your home outside, and you can dedicate time. I always tell my patients to, and colleagues and everybody, make sure find something that makes you happy. So in a day you can do that couple of times a day, so it keeps you relaxed. Whether it's meditation, if you are more religious in that sense that you want to do prayers, by all means. If you want to read holy books, by all means. And if you want to just walk or just do nothing, even do painting, great suggestion. Writing, and I have online seen a lot of people who were never into writing, they are writing their life story or something. So that's, I think, a great suggestion to indulge in activities which will relax anyone and get some positive energy. We all need some positive energy to keep going. So there's nothing wrong if you put that every hour or whatever schedule you have to keep you more relaxed. Our brain response is, like you mentioned, in anxiety is totally different. And I always tell, look at it like computer. Different parts of brain work actually beautifully if you let them work in synchrony rather than in a fight or emergency response, because all the body response, creativity, logic, thinking, all is gone once you are into emergency mode. And then your body cortisol also, actually with constant stress, can cause a lot of problem for your metabolism. So with that, it was pleasure, Sama, having you today, and going with on really nice tips. And stay safe, and keep reading my book. Keep it simple, diet, sleep, exercise. And if there's any, give us Twitter feedback, questions, and we love to answer those. And thank you.
Okay, nice.